Dr. Lilian Otiso. I'm the Executive Director of LVCT Health. We conducted a research study, or mainly an implementation research study in Korogosho and Viwandani. We started in 2019 and now we are coming to the end. And the study was to find out what are the gaps. So it was about accountability and responsiveness for equity in informal urban settlements. So mainly it was finding out within the slum settings who is vulnerable, who is at risk, what are they at risk for, how are they vulnerable, what services are they not able to get that they need, what is their experiences living in the community. And so through that study we were able to find that there were three categories of people who tended to be left behind, and that was people with disability, the elderly people, and also children heading households. But in addition to that, we conducted a study on teenage pregnancies, knowing that it's a big burden in Kenya and even in Nairobi, to see what are the experiences of pregnant adolescents within the slum settings. And so that's what we were able to go through their lives. And we did an interesting study called Photo Voice, which is where we gave them smartphones to be able to take photos of their experiences in the community. And they were able to describe what is good and what is bad within the settings. And now that is what we are showcasing today, to be able to identify that they know what works for them, what does not work. Like a dirty environment is not good, lack of food, poverty, things like access to water, access to health services. Those are some of the challenges they face, and that's for all the groups, including the pregnant adolescents. So that's what we've been presenting today. And what we did further was to partner with local community, partnered with 3 organizations, and they've been able to do training to get those, especially people with disability, in groups, get them to have financial capability training and to link them with available resources. So some of them have got employment. They've also been educated on just health, how to take care of themselves, and get some psychosocial support. Is that when you're doing programming, remember that there are those who are more vulnerable, those who are not going to be reached when you just say we're giving bursaries. They will not be reached by that, because first, they have no way of getting the information. 2, they may not even, or the other members of the community who are able to take care of themselves might not necessarily remember them or take care of them. When it's time for, and this came out very well during COVID, that maybe someone was bringing a water bowser, but they forgot that how does someone who is blind or who is physically disabled going to carry the water from where it has been brought to their house? How is an elderly person going to compete with young people who are energetic and are able to race to get the water? So some basic things like that is what really came through, and that is what we call applying an intersectionality lens, so that whatever it is that we do, we need to think from an equity perspective. Who is being left behind? Why are they being left behind? And what should my program do to make sure that they're not left behind? And so I was very happy to hear the MCA for Viwandani say, for example, he has set aside 20% of his bursaries for people with disability. That's very important. Research Institute, Grant Challenges Research Fund, from 2019 to date, it has now, that funding has come to an end. Our priority as an organization is, first, we try to make it as sustainable as possible. So we work with the communities, the community-based organizations, and so the awareness has now been created that we need to focus on these groups. And you can see already programs for people with disability are continuing. We do have, with our partner APHRC, we have guidelines on child-headed households, and a bill, actually, an act was passed by the county. So whenever these things are sustained, as NGOs, we do things, introduce the idea, then government takes it up. So the future for us is that the programs that are implemented by the county, by the MCAs, by the national government, and the policies should factor in these findings we have.